Thank you very much for, the honor to present this maiden project of NSODA in response to the pandemic that is hitting the whole world at this particular moment. So I'm going to try to be very, very fast because we're already late on time. So it's a very concerted approach that NSODA is taking to be able to fight this pandemic and to make NSODA ready and able to deal with it if at all it ever arrives in our precious land. So it's the presentation is going to be divided into 5 different sections. I would present the task force that is leading this initiative. Then we'll do some recap to make sure everyone knows what coronavirus is, the sensitization plan that NSODA has in place, the points of action that we intend to set up, and of course, we'll conclude. So the task force, as at now, is made up, of course, of our president, the president of NSODA, Stephen Jodrika, together with Mr. Banjika Ngo, who is our able resource person for all of this. He's very resourceful and we all can appreciate that. Then we have Dr. Gilbert Lawom, who is our medical expert, and myself, Robert. So what are the objectives of the task force? So bottom line, what NSODA, the message we want to pass across is that we are not in this battle alone. We have NSODA behind us and we can always count on NSODA when necessary to fight against this pandemic. So NSODA wants to mobilize every Wirfon in the fight against COVID-19 in SOC. We want to provide material to sensitize our people at different levels and using approaches that are contextualized and applicable to our villages around SOC. And we want to assist the institutions back home in any way possible, institutions, be it the health institutions, the businesses around Kumbu, the entrepreneurs to be able to participate in their own little way in the fight against the pandemic. So coronavirus, COVID-19, what is it actually? So I'm going to be very rapid in this because this is information that is very available on the internet. Coronavirus is actually a very large family of viruses and it causes diseases in both animals and human beings. There are several known coronaviruses that cause diseases to human beings, and most of those diseases are respiratory infections. So the most recent one, which is what we're facing today, is termed COVID-19. And what you would find as the most common symptoms of COVID-19 are fever, dry cough, or tiredness. If you're tired or you have a fever or you have very, very dry cough, then you definitely, there are high chances that you have COVID-19. Other symptoms can also show up, and these include shortness of breath, if you have difficulties breathing, if you feel aches or pains in your body, or if you have a sore throat, then there are high chances as well that you have coronavirus. Then it's very rare, but there are people who have been diagnosed with COVID-19 that had diarrhea, nausea, and running noses as signs as well. So if you have any of these signs and you are in Cameroon at this moment, in Sao or Bamenda or Douala, you have any of these signs, make sure you call immediately the 1510 toll-free number that was put in place by the Ministry of Health in Cameroon. Call and insist. You might not have a response within the first few times you call, but insist because the idea of having preventing corona is we make sure that as many people as little numbers of people as possible get sick or get infected with corona. But we also want that those who get infected get help as fast as possible. So insist on the call until you're able to reach the response team in Yaoundé. So how do you, what strategies are put in place now all over the world and specifically in Cameroon? I mean, you need to wash your hands regularly with soap and running water. And that is what you do with what you have, but preferably you should use an alcoholic hand sanitizer for that. So avoid touching your eyes, nose, and mouth. That is, if you touch any, I mean, you're moving around and you touch walls and objects, avoid touching your mouth, nose, and eyes after that. Make sure you always have your hand sanitizer or soap and a bottle of water, and you can always wash your hands any time of the day. Cover your face with a tissue or use your elbow when you want to sneeze. That is very, very important. As much as possible, you need to maintain social distancing. Stay at home as much as possible, only go out when necessary. In fact, if it's possible, don't go out at all. And right now in Cameroon, the wearing of masks is obligatory. So if you're going out of your house, you're going to go buy something from the market, you're going to stroll around for do sports or anything, make sure you wear a mask, if for nothing, to avoid problems with authorities and so on. So make sure you wear your mask all the time. How do you wear your mask? Because this is like the most, in as much as we want people to stay at home, we know that that is to some extent unrealistic and very, very difficult to implement, because most of us have to go out every day to fend for ourselves and for our families. So if you're going out, wear a mask. So what are the best practices in wearing a mask? First, the mask should be worn such that it covers your nose, mouth completely. So cover your nostrils, your mouth, and let the mask hang on top of your nose and below your chin. You should not lower your mask when you're speaking. That's like the most vulnerable period during which you can actually contract COVID-19. Most people wear a mask when they are not in areas where they can contract COVID-19 or in situations where they are at risk. And when they go to situations where they are at risk, that's when they are conversing with someone at close range, they remove the mask. That's like a don't. And don't avoid fidgeting with the mask. Yeah, it's uncomfortable. It's not very, we're not used to having something on our face all through for hours and hours throughout the day. But this is a small price that we need to pay to protect ourselves and protect our communities and our environment. So avoid fidgeting with the mask, touching it every now and then. Don't touch the inner part of the mask. I mean, that's the part that is directly in contact with your mouth and nostrils. If your hands are contaminated with COVID and you touch the inner part of the mask, it can become very fatal. Wash your hands after removing the mask, because the mask is supposed to protect you from corona, which means that if corona had tried to enter into your body, the mask would have it, would protect it, would absorb it. So if you hold your mask to remove from your face, after that, immediately you should wash your hands. Wash your clothes immediately and as frequently as possible, and make sure that once the clothes are dry, you iron them thoroughly. And the most important thing is, I mean, mask, yeah. Make sure that you have at least two, and use cloth-based masks. We know it's very difficult for us to have these disposable masks that are made for surgical wards and for the medical team, that are usable and are supposed to be used for a period of 4 hours, 5 hours, half a day, and then you have to throw it away. Use reusable masks. Have tellers around. I mean, I've seen so many people selling those around. Try to get one for yourself and always use it. And have two, so that when you wash one and it's being dried up, you can have another one that you can use while waiting for the other one to get ready. Treatment. As of now, there is no proven treatment for coronavirus. So, I mean, the most the advice that is given to people that are diagnosed with coronavirus is not different from what you would give someone that has a cold or has a cough or has a respiratory tract infection. That is, breathe into moist water. What we always do, heat water in a bowl and then cover yourself with a bed sheet or something and breathe in all of that moist air into your respiratory tracts. Avoid using products that contain nicotine, tobacco, such as cigarettes. Avoid cigarettes, even electronic cigarettes, avoid those. Avoid even chewing tobacco. Any of those things should be avoided. And as much as possible, seek medical care. Seek care from a professional healthcare provider. Don't completely rely on auto-medication or on medication from unreliable sources. Do your best to seek care from healthcare providers. And one thing to note, in Cameroon, as at now, treatment or care for COVID-19 patients is free of charge. So make sure you don't get hesitant about going to the institution, the health institution that have been identified in whatever town you are in as institution to take care of COVID patients. So what's that sensitization approach? As I said before, bottom line, what NSODA is saying is you're not in this fight alone. By you, we mean us all as individuals, us as families, our neighborhoods, our quarters and villages and associations and groups, and not forgetting our churches and health institutions and even NGOs that are within NSODA. So NSODA, it wants to work with each and every strata of society. And the idea is, go ahead, we are providing you with all the information you need so that you can actually be able to fight at your own level. And we are staying at the background so that if you block because you need additional information or you need help doing this or that, so that task force is available to help you. So at an individual level, the most important thing for you to do or for you to know is that NSODA is you. NSODA is all of us and all of us and NSODA. So if this has to work, it has to start at the individual level. And the first thing we all need to do as individuals is educate and inform ourselves about coronavirus. And once we've educated ourselves and we know that we need to wash our hands, we need to wear masks, we need to, all of those barrier measures, we need to put them into practice. Make sure that your families and everyone around you understands the principles and the barrier measures at the same level as you. And very important, refrain as much as possible from propagating unverified information. If you see something or if someone asks a question to you and you're not able to respond, there is no harm in Googling a little, to try to find a response before responding to any message that comes from. There is this thing in Kumbu, in So, when all of us, most people in this call us that our families back home depend on us for information. And if someone asks a question to President Banjika about coronavirus and Banjika responds immediately, the guy goes into a meeting hall or to a food house or to a bar or to a favorite place. And the way he will be talking about what Banjika said, it would be like information from Devena confirming for Germany. So make sure that you scrutinize and you refrain from sharing information that is unverified with people back home, because most of those people back home take whatever we tell them for gospel truth because they believe that we are at a better place to provide verified information. So let's play that role and always provide that verified information to our people. Then so the COVID-19 task force, we're going to share our contacts, and if you have any question that is asked to you and you can't find a response and you need help with it, you can always write us and we're available to try to find the response, the appropriate response for it. Then we added there the WHO number. It's a WhatsApp number with a bot. integrated, so you can interactively ask questions and it will respond, so it's very useful and very resourceful. At a family level, I mean, if there is a time when the saying that we are each other's keeper has all its essence, it is right now. So at the level of your family, you need to make sure that everyone understands and respects the barrier measures against COVID-19. It suffices for one family member to disrespect or to go out of line for the whole entire family to be in trouble, for the entire family to be infected. So if it has to work, it has to be holistic. The entire family has to be implicated in respecting those measures. Washing your hands, wearing masks should be something you remind each other of. I'm going out to go do sports and I've not worn my mask. My brother needs to remind me, hey, Robert, make sure you wear your mask before going out. I'm coming back from strolling outside and I'm about to enter the house. Oh, wash your hands outside before you get in. Or get a change of clothes, remove your mask and put it in the wash basin or something. So it's supposed to be something that is, like a common strategy. It's not supposed to be one man doing it and the others not respecting it. It suffices for one person to go out of line for the entire family to be in jeopardy. We've seen cases in Cameroon, in Yaoundé, where entire families die of coronavirus. So we need to be very careful. At the neighborhood level, I mean, if it's just like with the family, the neighborhood is just an enlarged family. We need to be each other's keeper. You need to make sure that your neighbors are keeping as much as possible the barrier measures against coronavirus. Come together in your neighborhood and see what works best. Come together, try to discuss with your neighbors to see what they're lacking in and try to see how you can help. Discuss and see if, for instance, you think that you have people who are at risk and together you can decide to say, okay, you have two houses, all the people that are at risk of developing very severe diseases due to coronavirus. We put them in one house to isolate them and make them safe. And then all those that are healthy, we put them in the other house. I mean, it's a neighborhood strategy. We can all do that. It's very easy. It's not going to be forever. It's very short-lived, hopefully. And help your neighbors. I mean, if you have something in your house and your neighbor needs to go get that thing from the market, the best thing to do to protect yourself and your neighbor is to give your neighbor that thing. That's just an example. Because your neighbor might go to the market and come back not only with that thing, but bring that thing along with corona. And who suffers? The entire neighborhood. So this is the moment when we need to share. We need to avoid people moving around, going far distances as much as possible. Our big compounds, our quarters are another enlarged family. It's the same measures. Make sure that your biki, your shufai, the head of your family, who is a person that is listened to a lot by the entire family, understands this coronavirus thing. Make sure that he understands that someone who is, he is not, supernatural. We know some of our shufais, how they would want to behave as if they are untouchable. Make sure they understand how vulnerable everyone is. Most of them are already of age. Make sure they understand that they are at risk of contracting it and they need to protect themselves and protect the entire family. And they have to be able to actively pass across the message of sensitization about COVID-19 to the entire family. Then in your quarter, as much as possible, there is always a tailor who does, either a big time designer or a patch as we call them. Whatever the tailor, try to have someone that produces masks locally. It is something that is easily doable. These are all of these things that we identified in the COVID-19 task force are things that we know can be easily accomplished within our communities by self-initiated, our local initiatives. We don't need to go out of our quarters of our homes to be able to implement some of these things. Get a tailor, provide them with sheets. You can get a bed sheet from your house that is you're not using. You give the tailor, he produces 50 masks for you, and you're good to go. It's not difficult to do. You just need to know that if it has to work, it has to be a collective strategy, and we need to be actively involved in fighting this corona response. Then our village groups and associations, the Njong houses, the meeting groups, the Njangis and everything. You are the president of an association. You are the president of, I don't know, Njangi, president of one food house, or I don't know. Right at this particular moment, your role is no longer just limited to sharing meetings and rolling out agendas, and then people follow, meetings of the last minute, minutes of the last meeting, sorry, and so on and so forth. You need to make sure that every time you hold a meeting, you're, one, respecting the barrier measures, two, communicating and sensitizing people about the COVID-19, and three, making sure that the people in your meeting understand and they carry the message across. Because as I said before, anybody that goes out of line puts the entire community at risk. So make sure that everyone is in line with combating coronavirus. I mean, churches now have been closed, but we still have in very remote areas some churches that still go on, but with very reduced population. So those should be used as a medium for sensitization and passing the message about corona and so on. At the village level, our village heads should take their responsibility into their hands. It is, I mean, we are just simply reminding people of what they should be doing, and, sounding the alarm that you should know that as this person with this responsibility, in this particular moment, this new responsibility encompasses to you as in your capacity. So at the village level, we all need to apply those measures. We need to make sure that the preventive measures are applied at the level of the families, level of communities, and at the level of the individuals. So it's a pyramid. If at the base everything is fine, at the top everything will be fine. So if we already implement all of these strategies as individuals, as families, as big compounds, as quarters, then at the level of the village, all of this would be very, very. Don't hesitate to bring up COVID-19 related discussions when you're at a village meeting. Don't hesitate to throw a word or two when you find someone that is supposed to be a leader in the village going as, I mean, don't hesitate to bring them back to line and remind them that they are supposed to be the example that people need at this particular moment. And especially right now that we are caught up in this struggle, this is a very important moment where we need to, come together and show our solidarity in the fight against COVID. Of course, we say wash your hands with soap, but Dr. Gilbert Lawong did a marvelous write-up on contextualizing some of these barrier measures to suit our context, our realities in SOC. If you don't have local soap like the savon that we have, or the detergents and everything, use your locally made soap. There are locally made, these Njangi women that make soap around, and it's very available and very cheap as well. Use it. Wash your hands. Just make sure that you wash your hands using running water, and you wash for at least 20 seconds. That's as simple as that. If you don't have detergent, use sabulu. I mean, it's as efficient as as it can be. Use wood ash if you don't have something else. Use wood ash to wash your hands. Our parents and ancestors used it before, and they lived longer than we even do today. So, and as much as possible, I mean, as much as you can, if you have the hand sanitizer, good and fine. Use it, move around with it, always have it. If you don't have hand sanitizer, have a bottle of water in your bag. Always have, if you have your backpack, have a bottle of water inside with some soap around. When you feel like you've touched an area that might put you at risk, get out your bottle of water and wash your hands. Pour it on your hands, use soap and wash your hands. So these measures are very, very important. Now, these are very general measures, but we have to understand that Corona, I mean, we've all seen the figures of the over 2-point-something million persons that have been affected by Corona. We have less than 2% or 3% deaths. So Corona is, yeah, fatal, but it's fatal with certain, in quotes, conditions. It's fatal most especially for people who are already with some pre-existing conditions. That is, people who are already vulnerable, whose immune systems are already weakened. Those include people that are already of a certain age, and people that live with HIV, people that have tuberculosis, people that have diabetes, people that have high blood pressure, and so on. So if you have such a person in your home, just know that that person is at risk. Most people, when they get coronavirus, their immune systems, if they are strong enough, their immune systems fight the disease and eliminate it. They just need to keep good hygiene and to stay isolated from the others so that they don't spread. But generally, most people that have actually gotten well of COVID-19 got well without having any medical intervention. But most people that died were those who already had pre-existing conditions or who were already of a certain age. So the people that are at risk of developing very serious diseases based due to coronavirus fall in this category. So if you have such a person within your household, take extra measures to protect that person. Limit visiting. Don't allow anybody from outside of your household to come visit that person. I mean, we have WhatsApp, we have other ways of talking and even holding meetings and so on. Use those, and internet might still be expensive, but I mean, it's costly. It's not, I don't want to say expensive because internet in Cameroon is not really that expensive. It's costly, yeah, but it's a good price to pay to stay alive. Avoid, keep perfect hygiene. I insist on the word perfect. Keep perfect hygiene around those vulnerable people. If anybody has to go to them, in fact, the best thing that is advised in such cases is have one single person that directly interacts with those people at risk. Always have that person who makes sure that they wash their hands before they change clothes every time we're going in, and so that the people that are at risk of developing severe diseases, if they contract coronavirus, we protect them from ever getting to the point of contracting the disease. So let's protect our elderly. Let's protect people, our very, very dear family members and neighbors and brothers and sisters that are at risk of contracting the virus and developing severe diseases due to it. So in our markets, I mean, this particular image is super nice, and I perfectly see it, sorry about that, I perfectly see it being implemented in squares or in market or in, I don't know, the Tobin market. There is absolutely, it costs absolutely nothing, and it takes absolutely no time for the woman that comes from Mba to come sell her potato, to come sell her mwang at squares, to take some 5 minutes to draw those circles in front of wherever she's seated. It takes absolutely no time, absolutely no energy, and it saves lives. So let's encourage our local Bayam Salams, our women, our mothers back there to adopt something like this. I mean, they are protecting themselves, they are protecting the children that they live back home, they're protecting their husbands, they're protecting every other person in the community. So it's very easy to do, and it takes absolutely no energy and no time. You don't need anything. All you need is sand or, I don't know, water, or maybe just a stick, and you draw around, the circles on the ground. You don't need absolutely anything to be able to arrive at that. Just taking 3 minutes to do that would save hundreds of lives. So let's encourage people to do that. It's the same thing here. The stores, yeah, they also have to do it. I don't know if Pashika is already doing it, but that's one of the biggest stores, supermarkets. I mean, it's the biggest in Kumu. And it's one of those that are actually still functional at this particular moment. So if there's one person that should be implementing this, should be someone like him. Even in the sheds, those lines, it's very easy for the people who sell in those places to just take half a day and draw some of these things in front of their shops and, delimit the number of people that come in and go out and how many people can be at a store at a particular moment and so on and so forth. This costs absolutely nothing, but it saves lives. Without it, we might have the consequences would be very catastrophic, but with it, we would have so many benefits. I mean, we would save so many lives. So let's encourage our people back home to do that. So NSODA is putting at itself at higher level and saying every Wirfon is not in this fight alone. NSODA is with accompanying you all around the way. The COVID-19 task force in NSODA, we've started producing some sensitization material that is very adapted to our context and adapted to the way we do things and the way we communicate and the way we call our local vocabulary. And those are going to be shared with all of these different strata, individuals, their groups and everything to help them when they're speaking so that they have some support material on which to base their sensitization efforts. And NSODA, as we know, is the largest, it's NSODA, because every small group most of them are affiliated to NSODA. So we are going, as NSODA, we're going to leverage on this network to make sure that the information about coronavirus and how to prevent it and how to deal with it, how to protect each other at the family and at the community and at the village level, and so on and so forth, reaches the grassroots. It reaches those who really need it. It reaches all of those villages in stock. Then we are also engaging in provision of masks. We'll try as much as possible to also provide soap and disinfectants and other basic needs. We're telling people to stay at home. So, we'll try our best as much as possible to be able to provide them with what NSODA can. And so I put this graphic here at the end to show us why it is very important that we start implementing some of these barrier measures. So you see the first four curves at the top of that graph show those African countries in the Maghrebian area or South Africa. And in sub-Saharan Africa, like Black Africa, Cameroon is topping. Like we have the highest number of cases, of confirmed cases of coronavirus right now in Black Africa. Which means that if there is one country that needs to take all of these measures like super seriously, it is Cameroon. So we need to put these measures into practice. Then we talk about these measures, but some people don't necessarily see how useful it is to implementing these measures to flattening the curve of the coronavirus. I'm going to give a very simple explanation of this graph. So the part in green actually shows what would be the situation if we didn't practice these protective barrier measures. And the part below in blue, sky blue and deep blue show the situation if we practice barrier measures. And the idea in COVID, in the response or in the preventive measures, is to make sure that we don't go beyond the capacity of our health system. The capacity of our health system is in the number of hospital beds that are put in place to receive coronavirus patients, the number of ventilators that they have, the number of ICU beds that they have, so on and so forth. So we want to make sure that the number of people who get infected and need hospital care don't go beyond what our hospital capacity can support. That is why these barrier measures are very, very important. The need for the barrier measures is to, the dotted line shows the capacity of our healthcare systems. So one way to look at it is that as long as we stay below the healthcare system, the capacity of the healthcare system, we're able to put everyone who contracts, not Ebola, sorry, who contracts coronavirus under treatment, and people who contract it and are put under treatment early enough survive. So if we go beyond, if we don't take these measures and we allow the number of cases to go beyond what our healthcare system can contain, then every other person that cannot be taken care of by our healthcare system is already a corpse, it's already dead. So you see all that part of the curve that is above the dotted line represents dead people. So if we don't take these barrier measures, the consequences are going to be very, very catastrophic to our society. So we need to implement these measures, again, as individuals, as families, as communities, as neighbors, and as big compounds, as jungle groups, as it's supposed to be a concerted effort. So that is here, we are available to provide you with any information you need. We'll provide material support, NSODA will provide material support as much as possible. And the bottom line is, it depends on each and every one of us. One person goes astray, all of us are doomed. So, thank you very much for the attention, and in conclusion, we need all hands on deck. Right now in the NSODA COVID-19 task force, we are just Banjika, Dr. Gilbert, the president of NSODA, and myself, but we need everybody. If you think that you have an idea, you have something you think you can. There's this guy who did a very, very nice video on, it was an illustrative video and speaking in Lamso and talking about Corona, what it is, and how you can protect against it, and so on and so forth. That's a laudable initiative. We need people like that. If you have any talent which you think can be useful in the response to Corona, don't hesitate to get in touch with the task force. We'll integrate you in, and we are in this together. We have other initiatives like the Dr. Gilbert himself took it upon himself to translate the measures and the recommendations of the WHO such that they correspond to our realities and back home. I see other initiatives like the daily or the bi-weekly, I don't know the periodicity exactly, a magazine that Dr. Gilbert is producing with Warren, which is as much super important as well, because when we tell people to stay at home, it creates other problems, and targeting those problems is another very important and vital sector of the Corona response. There are other initiatives like our musicians. There is Lontum who did a very, very super nice song on sensitizing on COVID and
Hello. I think we just lost Dr. Robert. Let's see. I hope he comes back. He was just wrapping up. Let's just hold on a moment. I think, okay. Yeah, he lost his connection. I'm sure he'll be connecting back, but I think we can all see he was just wrapping up and appealing for those who have the skills and ideas that can help build this task force, because as we know, people have been in serious pain with the war, and then with coronavirus coming in, it's going to be a very big challenge for all of them. And they are looking up on us, and I think it calls us to do more than we think we should be doing. I think there are so many cases that shows that our input to help them will be great. I don't see Dr. Robert.
I'm here.
Great.
Welcome back. I don't know at what point I was cut.
No, it was just absolutely fine. You were just talking about, just share your screen again and just wrap up. You were just talking about I think, asking for skills to come in. So yeah, share your presentation and just wrap up. Let's move to questions and answers. Yeah.
Okay, so I was saying that there are initiatives in SODA that are already very valuable, and I mean, we need more of those initiatives, and we are happy to, if you have any, if you know you can contribute any whatsoever, please join the task force. We need all hands on deck, and we need to be able to reach the grassroots, and we need to make sure that if at all coronavirus ever arrives, you know, whatever is happening anywhere, you know, because these countries minimize the risk of coronavirus, and we are today. So we have a head start. It's not yet there. We are learning from the mistakes of the others. So let's put to practice some of these things. Let's put all our hands together and see how you know, fight against this pandemic in our community. Thank you very much.
Great, great. Thank you very much, Dr. Robert, for that great presentation. We really appreciate it.
Ave you know, the one so